So the last best part of a week down in Cape Town has been really problematic for a number of reasons, not just the traffic, of course, but how it's affecting schools and how it's possibly even affecting the healthcare sector as a result of the Santaco-led taxi strike. It has, in the end, also resulted in the torching of buses and municipal vehicles, but infrastructure has also been damaged. Now, as far as the cost of people is concerned, I'm afraid 2 people have lost their lives as a result. Several others have been injured. The violent stay away not only brought the province to a standstill, but it's also disrupted a lot of services. Of course, the big concern right now is has it had any effect on the health sector? Well, Chief of Operations, Dr. Saadiq Kariem, joining us to talk about the impact on this. And Dr. Kariem, good morning to you, and I appreciate your time. I'd like to start with that. First of all, have you seen a negative impact on the healthcare sector because of this strike? If so, how? Good morning.
Good morning. Yes, absolutely. The strikes had a significant impact on our health sector in the Western Cape province because many of our clinics and community health centres are in fact situated in these volatile areas. We've had to close a number of facilities. We closed over 30 facilities between the province and the city. These are clinics and larger community health centres, which obviously means people cannot now access those services. And we've had to offer limited services at many of the other facilities in the area. We've also had to increase the red zone, our red zone areas. We have in fact declared over 70 red zone areas. Now this actually means that our ambulances and vehicles and staff in fact cannot access these areas. Mitchell's Plain, for example, was completely inaccessible last night. Neither ambulances nor staff could in fact get in or out of the area. And during the course of the night, we had an arson attack at a clinic in Knockon. So there's been quite a significant impact on the health sector, and we had similar impacts at the larger hospitals.
I want to ask again, Doctor, just about those clinics and the kind of work that they do make available to communities. But just talk to me about this arson attack on one of your clinics you just mentioned. Where was this clinic? I may have missed the name. And how many people does that serve? And is it a completely destroyed building, or is it just minor damage? What do you know?
Well, from what I've seen so far this morning, we still will assess the damage. The fire department has been there already. It's situated in Knockon. So it's one of the smaller clinics in Knockon. And there's also obviously been threats of further attacks at our other facilities as well. So we'll assess the damage this morning and then obviously take it from there. But that clinic in Knockon serves several thousand people. So those people will now not have a facility to go to.
And then the issue of the ambulances not being able to get into, and I think you called them red zones, for example. I mean, is there a way to account for the number of people that ordinarily require medical assistance or even an ambulance in some of these red zones? Are they generally very busy? And now you know for a fact that there could have been a few hundred people who couldn't get medical help. How devastating is that for these red zones?
No, it's very devastating for the communities that that live in these red zone areas. Remember, these are in areas that are highly dense, the densely populated areas. So there are tens of thousands of people that one clinic would serve. When we declare a red zone and our ambulance cannot get in, we have to have a law enforcement escort that helps our vehicles get in and out of the area. So Mitchell's Plain, for example, must probably be home, I would guess, to over 1 million people, which means that Mitchell's Plain Hospital, which then serves that population and beyond, people then cannot get to and from Mitchell's Plain Hospital. Our staff were in fact forced to stay over at the hospital last night as well because they couldn't get in and out of the areas as well. And we've had the similar impact at the larger hospitals like Grootskeel, Red Cross and Tygerberg. Their staffing levels there were between 40 and 50%. And that means we had to cancel our elective surgeries and only focus on the trauma and emergency cases.
And I imagine that then has a knock-on effect. If the strike were to come to an end, hopefully, at least by tomorrow, we are told by Wednesday, it's been put in place until Wednesday. What sort of knock-on effect do you then have to deal with? Yes, right now it's been about 6 or 7 days, Doctor, about a week's worth. But how far down the schedule does this push Western Cape Health? I mean, how many months are we talking here to catch up?
It will take us very long to catch up. We'll have to still assess how long that will take us. Remembering we're just coming out of COVID now, and we've just begun making inroads into those surgical backlogs. So this, unfortunately, is going to set us back a long time. I would guess several weeks at least, just to try and catch up, if not months, just to try and catch up. Remember, we've also had to focus and divert all our staff that we had available in our clinics to focus on the trauma and emergency cases. So to give a sense of the sort of workload of trauma cases, we've had since Thursday morning till this morning 0700. So Thursday morning 0800 to today 0700. We've had over 5,000 trauma cases being admitted at our hospitals. And so our staff obviously have to now deal with those trauma cases. Of those 5,000 cases, we've had about 227 gunshot victims, for example, with over 1,000 stabbings. So the services that we do offer, we have to focus now on our emergency services, and that meant the cancellation of our elective surgeries, which will now take us weeks, if not months, to catch up.
Doctor, you just made a good point when it comes to numbers of the trauma incidents as well. Just as I say goodbye to you, last question, those numbers you were just giving me now since last Thursday till now, is that an exceptionally high number? I'm wondering if that's a spike in trauma cases you're dealing with since the start of this taxi strike, or is that, and I mean this respectfully, fairly normal week on week?
That's definitely much higher than we would normally see. We monitor the trauma and our medical emergency cases very, very accurately. So I can tell you that that's definitely higher than we would normally have seen. And I would imagine that that's definitely linked to the violence that's erupting across the different areas in the Western Cape province.
Doctor, I appreciate your time in joining us this morning. Not great conditions for the Western Cape health sector to be working under at the moment. From Western Cape Health, Dr. Saadiq Kariem joining us this morning.